Hi again. This is part 2 of my thyroid cancer weight loss surgery video blog. And where did we leave off? I was supposed to have my radiation 6 weeks after I had my tumor taken out, and my insurance gave me the runaround, and I didn't have it basically for a year later, and I ended up having to switch doctors in order to get it. And when I went for the second opinion, the doctor that I went to was furious that I didn't have this radiation. It's I-131 radiotherapy. Actually, it's radiation. It's like a pill, a chemical radiation type therapy. Basically, you take this pill, and for so many weeks you have to stay away from people because you can give off radiation. And when I finally had it, I ended up moving my family out for a few weeks, and I stayed at the house. And it was difficult. Basically, that morning we went to the hospital and went into this special room, and this guy had this mask on and this bodysuit, and he took this box and he opened it up, and there was another box, and he opened it up and there was another box, and here was this pill, and basically I was supposed to take the pill, and then I had like so many minutes to get home and get my husband and everybody out of the house. And because the radiation pill wasn't given to me 6 weeks after surgery, they had to give me an unusually high dose of radiation. And 24 hours later, I started having joint pain, and I really didn't notice what was going on because I was pretty weak. Had a sore throat. They gave me a bunch of lemon drops, and I was told to that would take this funny taste out of my mouth. And my husband would come by and drop my dinner off on the step and talk to me from outside the window 5 feet away, and he'd come twice a day to bring me breakfast and dinner. And when all of that was over with, the kids and him moved back home, and I had to scrub everything and burn my sheets, and everything I touched was like contaminated. So we had to scrub I had to scrub everything and get rid of the sheets, and I just I couldn't hold my kids, couldn't hug them, couldn't kiss them. And then after a few weeks had went by, everything was fine. I remember my husband was like, let's get out of the house. Let's go up to the store for a little bit, get you out of the house. You've been cooped up for all these weeks. And I was in a lot of pain, and I was really weak. And I remember we had went to Walgreens, and I don't even know why we went in there. But I got out of the car, and I just was feeling really weak, and got a little buggy, and we headed down the first row of the store, and within 30 seconds, that was it. I was so weak, and it just totally debilitated me. I felt like there were big bands on my legs pulling me back as I was trying to walk forward, and it brought me to the floor. And I'd say for a good 6 to 8 months after that, I couldn't walk. Everywhere I went, I had to be wheelchaired. It took me about 3 hours to walk 12 inches. I couldn't walk. I didn't know what was going on. Went back to the doctor. They gave me the radiation, and said he didn't know what I was talking about. He didn't know why I couldn't walk. He said it might just be weakness. Should be short term. Give it a few days, give it a week, you know. So a few days turned into a few weeks, turned into a few months, you know, turned into just about a year. And I just couldn't walk. I couldn't do anything. Sit. Couldn't put my clothes on. Couldn't go to the bathroom by myself. Couldn't cook my kids their dinner. Couldn't house clean. You know. A lot of guilt came over me. And the depression started to sink in. And you know, I was only 30, 31 at the time. I lost my job. Yeah. Very hard. I think between the depression, not being able to walk, and feeling sorry for myself, and the lack of not having my thyroid levels balanced out right, I started gaining weight. This video's, I'm going to wrap this up. I guess I'll make a part 3 here, finish where I left off. Thank you for listening.